majority of patients that do have fibromyalgia do have chronic fatigue. Also, it's usually a diagnosis that's made when all other conditions have been ruled out. They've done like MRIs, they've done blood tests and all this type of stuff to try to identify certain medical conditions, and they can't find it. I'm Dr. Jake. I'm a naturopathic medical doctor and integrative physician. On this channel, I share with you how you can heal your body down to the root causes without any harmful drugs or surgeries. In today's video, I'm going to share with you everything you need to know about fibromyalgia. Let's talk about what is fibromyalgia. It's a condition of chronic pain and chronic fatigue. It is, you have certain regions of your body to make a diagnosis of it where you press like trigger points throughout your body. They're in your shoulders and some parts in your arms and your lower back and SI joint areas and multiple areas throughout the body to make this diagnosis. But it's this chronic musculoskeletal pain. It's usually more muscular. It's not like it's in the joints, even though a lot of patients with fibromyalgia do have pain in their joints too. But it's this pain in the muscles, and also feels like there's a lot of pain on the skin. Usually there's a lot of sensitivity to pain, like just a little touches can really hurt a lot. They work out, they're in extreme pain for long periods of time. Like they have sore muscles. Teresa was saying about her husband there. And many times it comes with chronic fatigue too. Those are two different conditions, chronic fatigue, fibromyalgia. They tend to go hand in hand. Majority of patients that do have fibromyalgia do have chronic fatigue. Also, it's usually a diagnosis that's made when all other conditions have been ruled out. They've done like MRIs, they've done blood tests and all this type of stuff to try to identify certain medical conditions, and they can't find it. So it's usually a diagnosis of omission. They really don't have another diagnosis, so they make this diagnosis. It fits the chronic pain thing going on, and they give that diagnosis. So a lot of doctors don't really know how to treat it effectively because they don't really know all the possible causes. We will talk about that today though, but majority of doctors don't really know how to treat it appropriately because there's no specific cause. There's not a lot of information on this condition at this time. If you treat the causes and treat the D's appropriately, the pain can go mostly all the way gone for sure. I treat a lot of patients this way there is definitely hope. You just got to go to the doctor that really knows how to approach it appropriately. It's not just doing symptom-based medicine, which is what most doctors do. With fibromyalgia, they give you painkillers, they give you antidepressants. And by the way, a lot of doctors think it's more like a mental illness more than anything else. And so they prescribe a lot of antidepressants, anti-anxiety meds for this condition. So yes, you just got to go to the right doctor that's looking further and really trying to find out why there's this chronic pain response happening in your body. Why is there this chronic pain signal being sent throughout your entire body? So that's what I do in my practice. When the patient comes in, I'm really looking at what are these causes, and if we treat it appropriately and to identify these causes, we can eliminate the pain that patients are experiencing. So are there any commonalities that I see in patients with fibromyalgia? I definitely see a lot more patients that are female. It's like at least 80% female compared to male. I do have some male patients, but when we look at the literature, it's overwhelmingly more female. Certain age groups, not necessarily. I see it, well, I don't usually see it in young children, but definitely see it a lot in teenagers all the way up to 90-year-olds. So it happens in any age group. I have patients that started getting fibromyalgia when they're in 70s. I've had others that have started in their 20s and now they're 70s, and they've been dealing with it this whole time. The only commonality I've really seen in patients is it's majority women for some reason. And that makes me think about a lot of different things, why that could be the case when I'm looking at causes of like, what is the difference between women and men? And that helps me treat the cause too many times. Now let's talk about what are the causes of fibromyalgia. So this is going to be pretty long. It is a complicated disease. Even though I was saying, we don't know a lot about it, we do know how complicated it is. There's a lot going on when I'm sitting back and I'm looking for, okay, what is causing this medical condition? What is causing this chronic neurological pain signal to be sent throughout the entire body? So when I take a moment to look back and really look at all the literature and also use my own brain power to be able to figure out what's going on with the patient, it's complicated. There's a lot going on. So first, I want to start with chronic infections, because I almost always, 90% of the time, patients have some type of chronic infection. Many times it's Epstein-Barr virus. That's the most common virus that I do see with this. But there's all kinds of other chronic infections I see. For example, I see cytomegalovirus, Mycoplasma pneumoniae, Borrelia, which is Lyme disease, Babesia, Bartonella, parvovirus, on and on and on. All these bugs that a person has been exposed to in the past that has reactivated. Sometimes patients get exposed to these viruses, let's say Epstein-Barr virus, and they get exposed to it, and then the fibromyalgia comes on board. But majority of the time, they get exposed to the Epstein-Barr virus, it goes dormant, and then it reactivates sometime in their life, and now it's leading to these fibromyalgia symptoms. So let's go back to like the main cause of fibromyalgia. Like the big thing is mitochondria trauma. That is what's causing these chronic muscle pain. When we get damage to our mitochondria, we have a lot of mitochondria in our muscles. So when they get damaged, that presents itself as muscle pain. Also, if you work out, it's going to cause a ton of soreness from any physical activity. Even walking up the stairs, it could cause a lot of soreness in your muscles. And that's because the mitochondria aren't working appropriately. And viruses like Epstein-Barr virus go and hijack the mitochondria and make it not work appropriately. So that's why chronic infections are so involved with fibromyalgia, and I see it so often, is because they like to damage the mitochondria, especially viruses like Epstein-Barr virus and cytomegalovirus. Usually some type of hormonal disturbance I see often. Usually the thyroid isn't working well. So if you've gone to a basic doctor, you got your thyroid checked, they probably just checked a TSH. And what I see more often in fibromyalgia patients is not they have just TSH issue, which is one way to make a diagnosis of hypothyroidism, but many times their TSH might look normal. TSH is just produced from our pituitary. It's just a signal that goes through the thyroid gland and makes your thyroid gland make T4. But just because the TSH is normal does not mean that your thyroid is normal. So that's why I go really detailed into it. So I'm ordering like a free T4 or a free T3, a reverse T3, autoimmune antibodies to really get a good look at what's going on. Because someone could have a conversion issue, not converting the T4 to T3 very well. They could not be getting the signal to the receptor site appropriately, but through the thyroid T4 and T3, it's not getting in the inside the cell well, and that's leading to, it's kind of like diabetes, but not diabetes. The thyroid becomes resistant. The cells become resistant to thyroid hormone. So there's all kinds of things going on with the thyroid that we really need to dive into that I see involved with fibromyalgia. Many times there's disturbances in women specifically, and this is quite common, is women have an imbalance of their estrogen progesterone ratios. I see this in a lot of my patients with fibromyalgia, probably at least 75%. They're producing way too much estrogen compared to progesterone. So estrogen is excitatory, inflammatory. Progesterone is calming and anti-inflammatory. So if you have an imbalance there and you have way too much estrogen, you're going to be more inflamed. You're going to be more excitatory. And when I say excitatory, that means the nerves become more excitatory. And long story short, with that, it leads to pain. It leads to anxiety. It leads to sleep disturbances. Most patients with fibromyalgia, it's not just chronic pain. Many times they're not sleeping well. They many times have anxiety. They many times even have depression. That's why a lot of doctors say it's a psychological disorder because they have all these things going on with it, but it's not really a psychological disorder. There's just all kinds of imbalances happening in the body that is causing psychological symptoms that people express. Another cause is, I see this quite often too, is their adrenal glands start not working appropriately. So they are either producing way too much cortisol or too little cortisol. Usually they start out with too much cortisol and then it goes to too little. So they start out with stage 2 adrenal fatigue, making too much cortisol. And then it could go to stage 3 adrenal fatigue when you're not making enough cortisol. So you definitely want to take a look at the cortisol and see if there's an imbalance there. I like what's called a diurnal cortisol, which looks at cortisol morning, afternoon, evening, and nighttime to see if there's a disturbance. Oh, you're making too much cortisol at night. You're making too little in the morning. You make it too little in the afternoon. So it's all variable per patient. So I really like this diurnal cortisol, so I'm able to make an appropriate prescription. Many times patients with fibromyalgia, they could have toxic exposure. So I like to rule out mycotoxins, which are mold toxins. I like to look at heavy metals. I like to see if they've been exposed to glyphosate, solvents, and many other chemicals. So we have laboratory tests and we could identify that. Or I base it on a detailed questionnaire to identify what chemicals they could have been exposed to. I noticed that food is a huge thing. Many times they have some type of food sensitivity, or almost always, not always, but most of the time, or not necessarily have a food allergy, but they have They're reactive to food. They make a lot of inflammation in response to foods. Like some of our most inflammatory foods are gluten, dairy, sugar, or corn. They're very reactive to these foods. It causes a strong inflammatory response, which leads to the symptoms. Many times the gut isn't working right. There's a lot of inflammation in there. There's trauma, there's leaky gut syndrome. There's an imbalance of the gut bacteria called dysbiosis. Many times they could have too many bad bugs compared to good bugs in their gut, causing this inflammatory milieu to form in the gut lining, which then causes chronic inflammation throughout the entire body, leading to pain. But also it can decrease nutrient absorption, makes the mitochondria not work well, and that leads to the symptoms too. There's more involved, but I think that's enough to talk about in this video about all the various causes of fibromyalgia that I deal with and what I like to order tests on to identify what's going on with the patient. Now let's talk about what do I do to actually treat a patient with fibromyalgia. First, we go back and we see what are the causes that we identified. So let's start with, okay, what do we do to treat someone that may be a cause of what's going on? This is just a theoretical patient. Maybe in the future we'll talk about all the specific patient that I treated, but I'm just going to go theoretical here that I see a lot in patients. Let's say someone came in, their causes were they had chronic Epstein-Barr virus, they had a food sensitivity, they had adrenal disturbance, and then they had a imbalance of the estrogen progesterone ratios. They had estrogen dominance. So I'm going to dive into what do we do for each one of these. So chronic Epstein-Barr virus, what we want to do is we want to prescribe treatment that heals the mitochondria, decreases inflammation, but also puts the virus back into its dormant state. So with viruses and other bugs, they don't totally get eliminated from our body. That's like a false doctrine that is out there. These bugs are totally eliminated when we get feeling better, right? They don't. They go dormant and they can reactivate themselves when the immune system gets suppressed for some reason. So we need to put it back into a dormant state. So I prescribe several different herbs to do that, like cat's claw is a really good one, Melissa officinalis, or many others. Maybe we'll talk more detailed about this, but these are some herbs that can go after Epstein-Barr virus. I prescribe several different nutrients like vitamin C and zinc and vitamin A to go after it. Sometimes I even, if I feel like it's aggressive enough, I prescribe a certain medication like valcyclovir to go after this too. And then chronic infections like Epstein-Barr virus, they like to form what's called biofilms, which are these mucus outside layers outside the bugs that makes it difficult for your immune system to kill it, but also difficult for any of the substances prescribed to go in and kill the virus. So we want to prescribe something to eliminate that biofilm. So there's some substances like EDTA, alpha lipoic acid, and other substances that work well on breaking down that biofilm, so we're able to so our treatments that we prescribe are able to work effectively. So that's going on Epstein-Barr virus, putting it back into dormant state. All these nutrients that help support the mitochondria regenerate and heal it and decrease the inflammation, actually increase cellular detox too. So we're going to heal the mitochondria, but also we're going to eliminate some of the trauma that's happening inside the cell, certain toxicants that are in there. And that glutathione and alpha lipoic acid are really good at doing that, eliminating that. Breaking down the biofilms is a very important thing because what happens is chronic infections form a biofilm. And that's the main reason why it's really chronic is, okay, you have this biofilm, the immune system's not able to get in it. The substances we prescribe aren't able to get in there. So we need to prescribe something to break it down. So I like to use EDTA, alpha lipoic acid, and acetylcysteine, and many others substances like alpha lipoic acid to break down that mucus outside layer. So the substances we prescribe, the antivirals, herbs, the antiviral nutrients, the antiviral medications are able to work effectively and kill off that biofilm. So we prescribe all these substances to get this Epstein-Barr virus back into a dormant state. So that's what we do there. Well, there's other treatments I do too. Those are just the oral supplements. I mean, I do some IV procedures like high-dose vitamin C, IV artemisinin, work really well. I like to heal the mitochondria with hyperbaric oxygen and red near-infrared light therapy. We've talked about these in previous episodes. And if people want, we could dive into this even more about these specific therapies. But those are some therapies I do for Epstein-Barr virus to kill the bugs, but also heal the mitochondria at the same time. So we talked about that. There's other things going on. Okay, the patient is estrogen dominant. The patient has too much estrogen compared to progesterone. So what do we do to fix that? So first, we want to decrease the estrogen. So we're going to give something called the DIM. That's my favorite treatment to really decrease the estrogen when you're making too much of it. How it works in your liver. And what it does is you have 3 different estrogens. You have 2 bad ones, I call it, and you have 1 good one. And DIM works by decreasing the bad estrogens made and increases the good estrogen. So the bad estrogen is excitatory, inflammatory, and can cause breast cancer, etc. Those are the bad estrogens. But then the DIM helps make the good estrogen, which doesn't have those side effects that go along with it, but you get all the benefits that go along with estrogen. So there's that. And then we want to increase progesterone. My favorite herbs for that are Vitex, peony, glycyrrhiza, dong quai. These are all great herbs to help increase the progesterone in the ovaries and also has some action in the adrenal glands. So that's what we do to balance out the estrogen progesterone ratios and get those balanced out. Next thing is I talked about is we want to go after the food sensitivities. So what we do is we first have to diagnose that, right? I order an ALCAT or leukocyte histamine response test to identify what foods they're eating that are a problem. We eliminate those foods from their diet. That's the most important thing. But then what we need to do is we need to heal up the gut that has been damaged by these food sensitivities. So what we want to do is we want to prescribe some substances that regenerate and heal the gut lining. I like to prescribe glutamine. I like aloe vera. I like good quality probiotics that have been shown in the research to help regenerate and heal the gut lining. And then I also like a substance called quercetin. This decreases the inflammation and decreases allergic reactions that are happening throughout the body. So this patient that came in with these 3 different causes, it's always variable. Every patient has little different causes, little nuances. So that's why you really need to go to a doctor that really knows all these little nuances, knows how to approach it appropriately, knows all the different causes. So when they're sitting down with you and looking at your history, they're able to identify, okay, I need to order these tests and I need to treat this accordingly. And what do I do to help patients that are dealing with the chronic pain when I'm dealing with all the chronic issues, right? Because it takes a while. It takes 2 to 6 months, maybe a year to get all these causes fixed, to balance out the hormones, get the gut healed up, kill off all these infections, etc. Right? So there are some treatments I do to help symptomatically treat the patient. There are some substances that I prescribe to help decrease the pain. One of my favorite substances is called low-dose naltrexone. I've talked about this in the past for autoimmune diseases. I've also talked about it with cancer, but we also do it for chronic pain. It's prescribed a little different. It's actually even going lower dose than the typical prescribing I do for cancer or autoimmune disease. So we go to like even 0.5, maybe even down to 0.1 milligram dosing, and we incrementally go up. And that can be a highly effective treatment for patients that are dealing with this chronic pain response. So that's one therapy I go for. There's also a supplemental product I really like that has a combination of several different herbs. It's called Pro Trauma, and I love that product. It works really well. It has some muscle relaxants. It has some herbs in there that have direct anti-inflammatory but direct anti-pain action to it. It has anodyne reactions is what we call it. That supplement can help patients feel better while we're treating the causes of what's going on with the patient. These are some of the main treatments that I prescribe for pain. I mean, there are some other things I do, like glucosamine sulfate works for some, curcumin, boswellia. These things can really help decrease pain. If we want to go a prescription route, and these are prescribed by regular doctors all the time, and a lot of regular doctors that say they specialize in fibromyalgia, they're experts in prescribing these drugs. And what they are is just anti-pain meds. So like opiates, like oxycodone or Dilaudid possibly. They prescribe muscle relaxants, which decrease the spasm of the muscle. Actually, when I'm talking about muscle relaxants, that just reminds me of another therapy I prescribe that's natural, is valerian works really well, or Jamaican dogwood tend to work really well for my patients too on relaxing the muscles, and I had some anodyne reactions there too. So sometimes I need to go for the really strong stuff for my patient when I'm going after the causes, but that's really rare. So if you want to get a hold of me, visit my website, integrativemedica.com. Find my phone number there, give my phone number a call, talk to my receptionist. They can set up an appointment with me. You could also set up an appointment directly from my website. If you want to learn more about the treatments that I talked about today and talk about identifying the root causes of other medical conditions, click my videos to the right. I'm Dr. Jake, and I'll see you there.